This Keloland Living segment is sponsored by Lewis Drug, where exceptional pharmacy services are a cornerstone of Lewis's commitment to communities.
Once known mainly for their role in weight management, GLP-1 receptor agonists like semaglutide and tirzepatide are now gaining attention for a broader array of potential health benefits.
In fact, researchers are exploring how these medications may impact cardiovascular health, liver function, and even cognitive conditions, reshaping how we think about metabolic treatment.
John Weiss is a clinical pharmacist with Lewis Drug in Sioux Falls.
He says while the clinical possibilities may expand, access to these types of medications may be limited because insurance coverage remains inconsistent, leaving many patients looking for alternative ways to afford these medications. Still, many patients may have options.
Welcome.
Yeah, thanks for having me.
This is certainly a hot topic, I would say, right now.
Yeah.
But it's kind of challenging to understand them all.
Yeah, definitely. And I feel like it's ever revolving, especially when like semaglutide or Wegovy came out 3 years ago. Like it just blew up, and then the media blew it up, and so then now each year it just seems like it's getting more and more popular, and patients are trying to find ways to get it because that insurance coverage is limited.
So let's talk about the different types of medications out there and maybe what the differences are.
Yeah. So right now, the two that are FDA approved for weight loss are Wegovy and Zepbound, which is tirzepatide. Wegovy is semaglutide. And also, too, both of them have also other indications, too. Wegovy will have the cardiovascular risk reduction, so preventing those heart attack and strokes, where Zepbound has obstructive sleep apnea. So those two separate indications, kind of how they found their way into the Medicare coverage. And so that's how that kind of opened, because Medicare won't cover medications just for straightly for weight loss.
Okay. Now, but if you are using, for example, the Zepbound for sleep apnea, do you also have to qualify based on a weight or anything, or is it just a general? So
it's usually, like for obstructive sleep apnea, patients have to be moderately or severe sleep apnea. You just can't have like mild sleep apnea. And so you have to meet a certain criteria. Weight isn't a factor usually, but some plans are dictating kind of weight as well.
Now, if you're taking it for sleep apnea, are you also seeing the weight loss benefits?
Yep. So a lot of times, like with like your sleep apnea, like by losing weight, you're opening up that airway too. So hopefully then breathing better, not having those like kind of quit breathing throughout the night. And so that's like kind of like the thought process, hopefully losing weight, then also that way then you're not being hypoxic during the night.
Ozempic, let's talk about that a little bit, because we saw on the screen there the list of other things such as, you know, looking at fatty liver, Alzheimer's, Parkinson's, I mean, all kinds of things.
Yeah, so Ozempic is only FDA approved for type 2 diabetes and then chronic kidney disease, so slowing that progression. They just recently got that indication. So you may even see patients, maybe their type 2 diabetes is controlled, but they have chronic kidney disease due to their diabetes, so that's another great add-on to help slow that progression. But this whole class in general, there's multiple meds being studied right now, anything from Alzheimer's. They're hoping maybe the potential thought is like that way the fluctuations in sugars help, you know, kind of slow that progression of Alzheimer's for some patients. You have osteoarthritis. You're even seeing gambling and addiction too being studied just because of how this molecule works on the brain.
Wow, it's really fascinating.
Well, there's so many out there, but they can cost a ton as well. How do people navigate that? Yeah,
that's like the hardest part, I think. And as like pharmacists, like we get that question a lot. And so a lot of times, like your cash pay option for these medications right now are looking over $1,000, like cash price. Right now, both companies, you're able to get those through them if insurance isn't covered for at least $499 a month.
Okay,
and so
still pretty expensive.
Yeah, very expensive for the average American or South Dakotan for sure.
But are there ways to reduce those costs? I mean, or do you just need to find?
That's probably like the best way right now.
Okay.
Recently, like previously, I guess, like patients were getting it compounded from different pharmacies, anything from Roe to Hims. The one thing like we really try to stress is like using a reputable like pharmacy, because you don't know what is truly in that product. Like if it's not FDA approved, it hasn't gone through those extensive studies. And so the best option right now is at least using those $499 programs. And insurance coverage is changing like all the time. And so like we're seeing more and more plans covering it. And then using that copay card on top of insurance sometimes can bring it down to even $0 or $25 a month.
And is that something people can ask you? Like you can come to the pharmacy and say, I'm interested in this. You don't necessarily, what I'm gathering is need a prescription to buy them, but
you will need a prescription.
You will also need a prescription.
You need a prescription from your doctor. I think that's a great discussion to have with your provider. Like if this is, like if you would meet criteria, because it's not just like getting 10 pounds of weight loss for beach season. And so like it have to be a certain criteria. Like the studies were kind of studied with patients who had a BMI of 27 or greater with one comorbidity, so like hypertension, high cholesterol, or a BMI of 30 and above. So like it isn't just for the patient who just wants to lose 10 pounds through the summer.
Okay, which is a really important thing to mention too, because there are so many advertisements and get it online from maybe a website that you've never heard of or a random place you've never heard of. So going and talking to a reputable place is really important.
Yeah, and that way then you know like actually what you are getting and that it's safe for you. And so like if you're going to your local pharmacy like Lewis Drug, like we are using like from the drug manufacturer, so it's FDA approved, it's reputable, and it's safe, and we can help you like even sometimes navigate those side effects that come with this class of medication, whether it's nausea, vomiting, and so just how to navigate those side effects down the road.
I think that's the scariest part, is that people could be getting it, you know, from a random place and still spending quite a bit of money on it for maybe it not to work, or maybe you don't know the side effects that could come with it.
Yeah, definitely. And I think just even for like providers or even pharmacists, like when we're doing drug interaction checks, like if a patient's not getting it through us, like we don't know. And like, and so like with us not knowing, let's say there's something in that compounded semaglutide that could interfere with your medication. So that's where it gets very scary. And so it's always good to let your providers and pharmacists know.
Now, if you're getting it through your doctor and a pharmacist, are there a lot of drug interactions to look at?
No. Okay. Usually, like a lot of times, like there isn't a lot of drug side effects. The one thing is with like Zepbound, that one, like if you are on like oral birth control, usually you have to have like a second barrier method while on that, just because it slows like the way the stomach empties. So just that first month, and with every dose change, you just want to make sure that way you don't have an unexpected pregnancy.
And there's a lot to think about, particularly when it is something you can buy online from a compound pharmacy, or I believe there are also places that are more cosmetic based that are offering it even in town.
Yep.
And so if you don't talk to the pharmacist, you
have no idea what you're getting.
It can be scary. It can be scary.
Well, thank you for coming and telling us about it and helping us know that we have a resource too if we want to talk more. Thank you.
Thank you.
Well, with 62 locations across the upper Midwest, Lewis has been a trusted neighborhood pharmacy and market leader for over 80 years.
From answers to your questions about GLP-1 medications and prescription medications for your child, vaccinations, and quick refills to longer hours, convenient locations, and more, you can find the neighborhood pharmacy nearest to you online at lewisdrug.com.
This Keloland Living segment has been sponsored by Lewis Drug, where exceptional pharmacy services are a cornerstone of Lewis's commitment to communities.
We'll be right back.